So for me, the first step is to acknowledge this, to understand the importance of the first and the second appointment, something that usually dentists take for granted. My point here is that expensive or not expensive is a very subjective thing. It all depends on perceived value and emotional priorities. So if we are great clinicians and great technicians already, we have the right, we deserve the right to explore communication skills, storytelling, patient experience, to change people's priorities, and to make people choose dentistry because we know that choice is the best for them, for the patient. And that's how the whole strategy of emotional dentistry started, and it became one of the main pillars of the DSD philosophy. And that's why when I talk about a case acceptance, I always talk about ethical case acceptance, because it means we really believe that what we are offering is the best for the patient, even though many times the patient can't see it. It's much more an educational process to allow the patient to own their decision. It's about allowing the patient to own the answer of yes or no by making them understand as much as possible the impact of their decision in their lives into the future. And because of that, make patients understand that this treatment is probably something amazing for them, and that they need to change their priorities and focus on this. But it means that we need to understand how to make dentistry an emotional ultra priority. And that means that every time we are seeing a new patient, first, second appointment, we need to focus on gaining emotional credits and not rational credits. That is exactly the opposite what dentists usually do, because we believe that we need to rationally defend our treatment plan, that we need to rationally explain why we are the best, that we need to rationally explain the consequences of not doing the treatment. When in fact, I'm not saying we shouldn't do that at all, but what really moves the needle is explaining all these things from the emotional side, connecting from the emotional side.